Today, in a series of Docplexus KOL interviews, we have with us Dr. Pooja Bhat. Dr. Bhat is affiliated with University of Illinois Hospital, Chicago, and did her fellowship from Northwestern University. Her primary focus is inflammatory diseases of the eye. Dr. Bhat specializes in the diagnosis and management of infectious and non-infectious ocular inflammatory conditions. Her main areas of interest are posterior uveitis that include Vogt-Koyanagi-Harada disease and Bechets sarcoidosis. Thank you, Dr. Pooja.
Thank you so much for having me.
So let's begin with the first question. According to you, what are the causes and complications that are associated with VKH disease?
So Vogt-Koyanagi-Harada disease is an immune condition, and the immune attack is against melanocytes. These melanocytes are found in the skin, in the meninges, in the inner ear, and of course in the eye, in the uvea. So patients will present with, with a ferocious attack, and patients will have ringing in their ears. They'll have a headache. They can't see because there's inflammation in the eye, and they can have, chronic skin changes when the disease becomes chronic. The exact cause for VKH is not known. We don't know what precipitates the immune attack, but we do think that there's some genetic susceptibility because there are some, loci that it's, more commonly associated with.
So moving on to the next question. Doctor, can you share some insights on the management of VKH disease?
Sure. So, as I said before, the patients present with sort of ferocious inflammation in both their eyes, and more often than not, they will have disc swelling. The vision is poor, so we admit these patients and we infuse them with corticosteroids at least for 3 days, and then we transition them to high-dose steroid therapy. These patients actually need systemic chemotherapy. They need systemic immunosuppression. So we have a conversation about that in the beginning, and we typically end up using either methotrexate or mycophenolate to immunosuppress these patients as we're sort of tapering off the steroids.
So my next question is, can you share some experience managing a difficult or a challenging case of this disease?
Yes. I think the condition affects young people, young adults. So I think it's a devastating sort of vision loss that they experience. And then we have to have this conversation about chemotherapy, about immunosuppression for your eyes. It's not cancer chemotherapy, and usually we do this therapy for at least 2 years. So it's a hard concept for patients to swallow. It's a condition that can result in flares of inflammation. So I think it's very challenging for the patient. It's very challenging for the physician managing the condition. I think just you develop a close relationship with your patient, and I think every case is challenging in its way.
So lastly, as you know, Docplexus is an online platform for doctors. What do you think this platform can help in gaining knowledge amongst the doctors?
I think it's an excellent way. It's an excellent platform to have physicians look at these interviews because not everybody will have expertise in one particular area. So you may see a general ophthalmologist may see a VKH patient once a year, but I think if there's some platform that they can listen to, they can view things, I think it will help them, at least help that one patient that they see.
Thank you so much. It was a pleasure having you.
Thank you so much for having me.